So what is hyperhidrosis? Hyperhidrosis simply means excessive sweating. So there are many of us who suffer from this condition, and it can be very distressing at times. One must consult a doctor if your excessive sweating is leading to some emotional distress in you, if it hampers your daily routine activities, if it is forcing you to socially withdraw yourself, if it is leading to some kind of embarrassment to you, or if at all you've been noticing a sudden night sweating which is because of no apparent reason. So what are the causes of hyperhidrosis? ये क्यों होता है? It can be primary hyperhidrosis जो generally families में run करता है. This is generally genetic in origin because of some faulty nerve signals. आपके sweat glands जो होते हैं वो थोड़े ज़्यादा activate हो जाते हैं. Other than that, there are other causes of hyperhidrosis which comes under the category of secondary hyperhidrosis, जिसके कई external reasons हो सकते हैं. There are few disorders like diabetes, thyroid, menopause, and certain types of tumors in which you can sweat excessively. Other than that, there are few drugs like antidepressants. If you are taking, that also can lead to excessive sweating in your palms, soles, or your axillae and pubic areas. So now, if you've got a problem of hyperhidrosis, you should consult your dermatologist immediately. Your dermatologist will advise you different methods to control the problem. सबसे common जो इसमें use किया जाता है, that's an antiperspirant. Which is basically a chemical-based treatment in which your doctor will give you some sprays or lotions to apply on the affected areas. These chemicals generally contain aluminium chlorohydrate or propanthyl bromide. How do they help? Now, these antiperspirant sprays, which all of us are used to use, how do they act actually? So what happens is when we are spraying them on the affected areas, they actually block the sweat glands. They sit on the surface of the skin and are pulled inside whenever we sweat, and they physically block the sweat glands, thereby reducing the sweating actually. But for long-term usages, the safety is actually a little doubtful. Other treatments which a dermatologist might suggest to are idiopathic, which is again a little cumbersome technique in which a low voltage current is passed in the water, which temporarily shuts down your treated sweat glands. The treatment requires multiple sessions. At least you have to take 2 to 3 sessions per week for approximately 2 to 3 months regularly, and thereafter you can maintain. Each session will take at least 20 to 40 minutes time. So the third important treatment which is available, which your doctor can suggest you, is the botulinum toxin treatment, which is of course more expensive and is a little painful if you ask me. This treatment actually blocks the chemical which stimulates the activity of the sweat glands. So the treatment is in injectable form. Your doctor will give you multiple injections on the affected areas of your body like your palms, soles or axillary areas. So it is again a temporary treatment, can give you results for at least 4 to 5 months and has to be repeated thereafter. And last but not the least, there are certain pharmaceutical drugs which also can help. So seek help if you are going through hyperhidrosis. Thank you.